I want to thank you for joining us for another Facebook and YouTube Live. We're going to have a very powerful topic on the need of from policing to purpose, rethinking academic integrity in nursing education. We're going to make it very practical, talk about numerous strategies and ways that we as educators can create a culture that emphasizes academic integrity. But before I do, I just want to introduce myself. If we haven't met, my name is Keith. I'm the founder and CEO of KeithRN, which is really something that, a mission and vision to transform nursing education based on Dr. Patricia Benner's work, Educating Nurses, a call for radical transformation. When it came out in 2010, I was an early adopter of some of the radical, the changes that we must make within nursing education to, again, bring it back to its original purpose and to strengthen how we teach nursing. And so really my passion with KeithRN is to create resources and tools to equip and empower nurse educators, everyday educators, with the best possible tools and resources to teach more effectively so our students are better prepared for practice. And so that includes case studies, handouts. We have a membership site, and I'll share some things in just a little bit. But the bottom line is that we want to transform nursing education one educator at a time. And I want to thank you all who are joining us live. We're going to have a crucial conversation. And I want you to introduce yourself. You are here. You're live. You can ask the questions. Myself and Maria are going to have a crucial conversation about academic integrity in nursing education and what we can do to create that culture. And we're going to be using Dr. Amanda Tracy reached out to us, and she shared her dissertation study that has been published in the Journal of Nursing Education. Now that is like, my kudos to Dr. Tracy, because you know what? That was my dream. I never got there with my dissertation. I think for many of you who have been on that dissertation journey, but she got it published. It was that powerful. And I'm going to put the link in the chat so that we all can, I'm going to give you all a head start. It's a full text, free article, which is amazing. And so thank you, Journal of Nursing Ed and Dr. Tracy, for their work. But the title of the article is Strategies for Academic Integrity Orientation in Undergraduate Nursing Programs, a Scoping Review. And we've got a gap that we're going to talk about. So stay tuned and stay with us. And so last month, we talked with Dr. Garrett Chan of Health Impact in the Benner Institute, and talked about the North Star of establishing practice readiness, what we can do to strengthen clinical teaching. And if you missed that Facebook Live conversation last month, we do this every month. I just want you to know that we have got a YouTube channel that everything is archived for perpetuity or whatever. And I want you to know that is, I'm going to put the link to our YouTube channel, Think Like a Nurse. You can access prior YouTube Facebook Lives, as well as literally over 100 videos that I've done over the years. KeithRN has been on this journey, just being a leader to transform and to just really advocate for needed change in nursing education, along with Dr. Benner and many others. But the YouTube channel has got resources for students, for educators, some concise videos, so explore that if you haven't. I also just want you to all know that we also, KeithRN is the admin. Myself and Maria Flores-Harris, our educator consultant, is we have a Facebook group called Teachers Transforming Nursing Education. If you're looking for a community, because we must do community in order to support each other to see needed change. And so I just want you to know that this has got over 20,000, almost 20,000 nurse educators who are highly engaged, share their resources. And if you're a member of that resource, please just go ahead and, and share what you're finding most helpful. But I also want you to share those that are here live. Don't be shy. Tell us, just jump in the chat and share where you're coming from so we can get a sense of kind of the scope. Sometimes we get international from Canada, Australia, and it's just exciting and encouraging just to know who's out there today. So please, this is going to be a dialogue. I'm going to start with a little bit of a monologue, but we're going to bring it into dialogue in about 5 minutes. And we're going to then go deep into this topic as myself and Maria talk about that. I also just want to let you know that we have a brand new resource called Bridging Teaching and Practice, Essentials for Clinical Nurse Educators. It's a comprehensive 20-lesson 13 CE course that goes into practical strategies to teach clinical, as well as over 50 tools to operationalize clinical judgment and what that, an application of patho and other essential sciences to develop the thinking of practice. And so that course has been, we just made a couple of significant changes I'm just going to highlight, and then I'm going to give you a brief commentary, and then we're going to jump in. We basically have done two things. Number one, lifetime access. It's no longer going to be an annual renewable platform like a membership. It's a one-time course. Purchase it one time, same price. You get access to the teaching. You get access to the tools for your lifetime as an educator. That's a real value. And I felt that that was necessary. The other thing that we are now offering are an installment plan. It's an affordable course for 13 CEs. It's actually priced incredibly reasonably. I'll let you go to the landing page, check it out, learn more. And I want you to know that if you're a clinical educator, most clinical educators don't get a structured or even a formal of any kind training to go from being an expert nurse at the bedside to teaching. That's a problem. And that's one of the many reasons we have an academic practice gap that I am passionate, along with many other educators, to bridge so our students are better prepared for practice. And so I just want to, before I go into a brief commentary, I just want to just welcome those that have already plugged in. Sarah from Kansas, Sheila, Saskatchewan, that's a Canadian neighbor. My father was from Winnipeg and has family. The family was, we went across the border to Canada so many times, and I love Canadians and their wonderful accent. Donna from Connecticut, Christine from Texas, Katie is from Boise, and Raydell from Glencock, Wyoming, Tiffany in Phoenix, and Patricia, welcome in New York. And so again, we've got many others here tonight. And before we get started, I just want to kind of share my heart with you, kind of give you a Keith commentary for just a couple minutes before we dig into tonight's topic. And really the topic I want to just share my heart with is transformation versus reformation of nursing education. And I've talked about this before. I'm going to spin it a little differently tonight. And this is really important. We need to define our terms. When we look at transformation, because Dr. Benner said we have to call for radical transformation. Now, what's the best example of transformation? It's the metamorphosis of a caterpillar into a butterfly. But it's a living organism. And I think when we look at transformation, saying we can transform nursing education, I say, no, we can't. We can only transform that which is alive. And you know what's living? Me and you, fellow nurse educators. Yes, insects and caterpillars can change, but so can we. How do we transform ourselves as educators to bring about the needed change? By changing and transforming the way we think, renewing our mind with what is true. And what is that primary purpose of nursing education? Because when you look at reformation of an institution, you can only reform that to its original purpose. Like when Martin Luther reformed the church from some of its practices that were not scriptural, like indulgences and paying your way to heaven, Martin Luther said, this is what the scriptures say. And it was truth, and it needed to be brought back to its original alignment. And what I think is really, what I see from my vantage point is kind of, a nurse educator who's kind of on the outside looking at everything. And this is where I want you to come in and throw your comments of anything that I'm sharing here. We need to reform nursing education to its original purpose, which is we must emphasize putting practice first, preparing students for practice as our primary priority. And like C.S. Lewis said, when you put first things first, you get the second thing thrown in. But if you put the second thing first, you lose both the first and the second. And if we're honest as educators, let's be real. We have put a culture of NCLEX success as our primary purpose, our first-time pass rates, and I get it. But we've lost sight of practice and giving them the competencies, the clinical judgment skills to be prepared. And even our topic tonight of academic integrity, when we have high stakes testing, the NCLEX, our predictive testing scores from our vendors, we create a culture that creates this culture where we are basically creating a monster. And we need to recognize that the way that we're approaching testing, the way that we're prioritizing the NCLEX in academia is actually part of that reformation. We need to not necessarily go away from it. We just need to put first things first so we get NCLEX success, which is the second thing thrown in. And if we lose sight of the first thing, we lose that we lose practice readiness. I want us to see that as educators. And if that resonates with you, if you just disagree, even put it in the chat. I want to get your feedback if that resonates. And what I would share is this, is that as nurse educators, let's basically embrace a new paradigm. Recognizes that as it relates to nursing education, let's put the first thing first. Let's de-emphasize predictive testing. I passed my NCLEX in 1983 on the first time from an ADN program. And you know what? There was no such thing as predictive testings. There was no HESI. There was no ATI. It was just taught well, prepared for practice. And you know what? I developed the clinical judgment and other skills essential with a well-done curriculum and program. And one of my concerns is that as we look at nursing education, even currently, is that we're being, without realizing it, we're being subservient to a corporate curriculum because our students won't read the textbooks, but they'll do this corporate curriculum. And recognizing that the vendors of these corporate curriculums, what's their primary business and their mission is passing NCLEX. Is that a good mix? I'll let you decide. Textbooks and expecting our students to read reasonable amounts of information is part of the partnership we need to embrace in nursing education. And so I would encourage us as nurse educators to rethink the high stakes culture that we sometimes put on our predictive testing scores. That if you don't maintain this metric, if you don't get that score of this, you don't even pass the program in some places. That's going to create a culture of cheating. And that's part of the problem that myself and Maria will talk about tonight. And so I would just encourage us in closing to really reform nursing education. Let's adopt a new paradigm of kind of cutting the cord. Like they say with cable, cut the cord. You don't need the big companies. You just need these streaming services. Let's cut the cord of predictive testing. Let's consider it. Let's at least move away from de-emphasizing it. It's going to be a journey. And sometimes, like addictions, that we're addicted to some of these things, there's a little withdrawal, but we need to start stepping away from the corporate curriculum and the things that really are enslaving us. Because if we're willing to pay that price hike every year, you're a slave to the machine. And you need to recognize that you don't need them as much as they need you. And we can cut that cord. We can begin to take ownership of what we do in nursing education with our curriculum, with how we teach, what we teach. And that's my passion, because I say you can do it low tech by just changing the way we teach and vendors' paradigms, and I'm sticking to that. And so if anyone has any thoughts on that, you're welcome to your opinion, and I'm open to, I have mine. So this is who Keith is. If this isn't you, if you don't want to change and you just want to stay in the system and be a slave to the machine, then be like Neo in the Matrix and just stay where you are. But I want to take the red pill of what is true. And that's my heart. So I have no axe to grind against these companies. I'm not against them. I'm against the priority that we put and in this culture and how it's not helping us prepare students for practice. We need to reform how we teach nursing. That's part of the problem. High stakes testing is part of the problem. And with that, I'm going to pass. Like if I was in a recovery group, I'm going to pass. But thank you for listening. And we're going to dig into tonight's topic because it's really important. And I'm going to bring on Maria. Maria, come on in. And join us tonight. Maria is our nurse educator consultant from KeithRN. And Maria, just introduce yourself because this is a passionate topic for you. And why don't you just briefly just share what you do with KeithRN, but jump right into just what you want to share tonight, because we're going to spend the rest of this evening, the rest of the hour until 9 o'clock Central, talking about this and getting your questions, answering your questions, and providing a lot of valuable information and some links. So Maria, go ahead.
Well, hello, everyone. I am the nurse education consultant, as Keith mentioned, for KeithRN, and I'm really here to support our customers. So, support our Think Like a Nurse membership. Those of you that have purchased the clinical course, those of you who use our student workbooks, I am here as your support. So, if you have questions, you want best practices, you need help with implementing them into your curriculum, I'm here to help with all of that. So please feel free to reach out. Also, if you're not a customer, but maybe you're interested in being a customer or you have questions, I'm also the person to contact. I'm happy to answer your questions. I'm happy to provide a live demo of any of our products. So please feel free to reach out to me for any of those. And with that, I am going to jump into academic integrity because that's why we're here, I hope. And as Keith mentioned, Dr. Amanda Tracy reached out to us and shared her dissertation work. And we really, academic integrity is a passion of mine. I'll talk to you about why in a moment, but it was also for Amanda's. And Amanda and I had a conversation. And Amanda planned to be here, but she already had a trip planned and kind of forgot about the trip. She got so excited about being on the Facebook Live, and she had to cancel us last week. And that's okay. I told her we would have her back. I'm sure this will not be the last time that we address this topic. But I asked her permission if we could go ahead and share her information. She does. I do have a link to her dissertation as well as the article.
Yeah, I just put the article up for you, Maria. You can.
Okay. Yeah, sure. And so because she does have a full dissertation with obviously more information than what's in the article. And then, of course, the article in the Journal of Nursing Education. So we're happy to share that, happy to promote Amanda Tracy. And what I want to do to kind of set the tone for tonight, I mean, obviously, we're pretty passionate when it comes to academic integrity for a lot of different reasons, I would imagine. But I want to tell you what Amanda and I talked about and why we really wanted to bring this topic forward. And of course, Keith and I have talked about this all the time as well. And Keith is very supportive of this topic for the reasons that he just mentioned. When it comes to academic misconduct or cheating, okay, academic misconduct is the politically correct way to say cheating. But when it comes to cheating, many of us in nursing education point the finger to the student. I always hear faculty say, these students, this generation, they should know better. They this, they that. It's always the student's issue. And most of our policies in our institutions seem to back that up because, and this is actually in Amanda's article, if you want to know where I'm going to get this data from, that 95% of academic integrity policies mention student responsibility. Only 39% mention university responsibility. Well, I'm here to tell you, and I've learned this firsthand, that cheating is not a student problem. It may be a student problem for a minute percentage of students, but cheating is an environmental problem. Cheating is and this is coming from James Lang. James Lang is an author and educator who wrote a book called Cheating Lessons. He says that cheating is an expected response to an environment that is not working for the student. And I completely agree with that. And that's why I say it's not a student problem, it's an environment problem. We are creating an environment that is not working, that is not focused on the right thing, on learning, as Keith said. we're focused on performance. And if we're focused on performance and focused on high stakes, we're inviting cheating into our environment. So that is really, I think, number one. That is me setting the tone, because I hope that even if you don't agree with me right now, that by the end of tonight, when we talk about some of these things, you'll see that we do have some responsibility in this. It's not, again, just a student issue. So, what I would like to do is I want to invite you to please put in comments, questions in the chat. And the first thing that I want to do is ask you to put in the chat what keeps you up at night. I'm just going to say it that way. What keeps you up at night when it comes to academic integrity? I'm assuming I mean, those of you that are here, you probably have a reason for being here. In other words, you've dealt with some issue. You may be dealing with an issue now. This may just be important to you because you know how important integrity is to nursing. But if you have anything that you want to discuss tonight, you have some issue that you are dealing with, a circumstance maybe, please feel free to drop those comments, questions in the chat so that we can talk about those, because we do want to address the issues that you are going through. And Stephanie, I saw your question, and Keith has already put a link there to the book, Cheating Lessons by James Lang. And James Lang has written some other great books too about education. I love his books. He's obviously a super intelligent guy, but I love the way he writes, because he writes on a level that I can understand. I'm not one of those people that uses the 25-cent words. I like to let's just say, speak to the people. Tell me what it means. Be straightforward with me, and he does that. So I'm seeing some of your comments already. I love this. To me, it's an ethical thing. If you would cheat in academic setting, what would you do in your practice? Jared, we're going to get to that. AI keeps me worried. Sheila, AI is keeping everybody worried. That these students will grow into nurses that also take shortcuts. AI taking over. I don't know, for those of you with AI, if you've seen the new Mission Impossible movie, you'll be even more worried about AI. Improper use of AI usually due to recommend use in prereq courses. Okay, Sarah. So AI is being recommended to use, that the misconduct of the student will carry forward to their practice, compromising the healthcare team. Those, absolutely, you guys are so right. There is, I will go ahead and say it. I have several articles. There are several articles out there, several studies that show that academic misconduct does, I'm not going to say leads to, but people who cheat in school are more likely to cheat or be involved in misconduct in practice. It does. You're right, Tracy. It does carry over. So let me share a few more things with you that have come from Amanda's article. She did mention that there is a connection between integrity in school and professional practice. So that, of course, is very important. Think about it this way, guys, because one of the things that did come out of Amanda's research also is that faculty have a couple of issues. Number one, we're not educated on academic integrity and how to handle academic misconduct. And when I say educated, there's not a lot of formal education, even for those of you that are that have, maybe have your master's or your doctorates in education. There's not a lot of mention about cheating and how to handle cheating. Most schools have policies, but when you do orientation, they don't really spend a lot of time on the policy. Some don't spend any time. They just tell you, there it is, sign that you've read it. And then we do the same thing with the students, right? We spend no time talking to the students. So faculty have an issue with lack of education. So therefore, our students are not educated on cheating and what it constitutes and what the consequences are and how to handle it. I want to ask, for those of you in the audience, what type of education or orientation have you received on academic integrity and academic misconduct? Just put some comments in the chat. I'll keep talking, but that's one of the questions I really want to get answered, and see how, if maybe you guys are doing better than those that Amanda interviewed for her article and her dissertation. But that was one thing that was found, is that the education is lacking, the orientation is lacking. The other thing is the consequences and the follow through. Very often, because faculty don't know what to do, or because it can be a long, arduous process to actually turn in a student for cheating, faculty may look the other way. And let me say that if we are guilty of doing that, if we are guilty of allowing cheating to occur, then again, we're building that environment where students are going to say, oh, I can get away with this, so I'm going to do it too. And we're creating the environment that invites that cheating. So I am going to look at our comments here. Read the policy and sign. We have a policy in our handbook. We have a statement in our syllabi. But what do you do with those? Right? I learned the most when it was encountered, Samantha says. And Samantha, that is exactly what Amanda found in her article, that most of the learning was learning in practice, if you will. It happened, and then you had to figure out what to do. Many discussions in graduate coursework. Okay, Laura had many discussions in graduate coursework. That's wonderful, Laura. Sarah says none. Review schools policy, an entire course in my PhD program related to policy making for conduct. All right. The only orientation was to read the faculty handbook. Okay. Sounds like a lot of you are seeing what Amanda saw, that you're basically told, there it is, read it, sign it. Sometimes a couple of you have said nothing, but then there are some of you that said that you've gotten some courses and gotten some education, and that's wonderful. Maybe the tide is turning there. Whoa. Okay. That was from Keith, listing some of the most common. No specific education, just things to watch for with Proctor track policies in place. Okay. Yep. All right. So it looks like you guys aren't much different. We're not getting the education. We're not getting the orientation. And most of us do learn once it happens. What Amanda found was that nurse educators often lack the confidence and the training. And that is because there is minimal training and minimal education. And she also found that this really takes an emotional toll on faculty when they know that cheating is happening, or they suspect that cheating is happening, and they don't really know what to do. They don't know how to deal with it. A lot of faculty were really feeling the strain. And now I want to stop here, and I want to ask you guys a question, because this is something that I've been faced with many times. I used to work for a testing company, and we dealt with academic integrity issues on an almost daily basis. And one thing that we were constantly told by our customers is, well, we don't really have the black and white proof, so we can't do anything about it. And I didn't buy that. I don't buy that, and I'll tell you why. Here's a scenario. This is an actual scenario. I'm not making this up, and I bet you guys have heard of this. We could have a student take 100-question multiple choice exam. Not even multiple choice. There were actually some alternate items as well, but could take 100-question exam on the computer, make a 99% on it, and do it in 10 to 12 minutes. And I was told that I don't have the proof that that student cheated. Guys, I have sat across the desk from a student and have said to a student, I tried to read 100 questions in 10 to 12 minutes, and I couldn't even read the questions, much less read them, answer them, and get them all correct. It's not humanly possible. Therefore, if it is not humanly possible, then the student did something. And there is no way that we cannot address that with our students. And one of the things that came out of Amanda's research, one of the recommendations is that if you have a scenario where you believe a student has cheated, number one, you don't have to accuse the student. You can just say what I just said. Here's the truth. You scored a 99% on a 100 question exam in 10 minutes, and no one, even a seasoned nurse, has been able to do that. So we need to validate your score. And so you give them a verbal exam. I've seen it done before. You give a verbal exam, within the first minute, you realize the student has no idea how to answer these questions. If a student can make 100% in 10 minutes, they should be able to rattle off answers, right? Well, when they can't, usually what I've seen happen is the student falls apart and admits that they cheated, and we move on. So here's the other thing that has come out of research and has come out of my own experience. We want to try to make these scenarios, these I shouldn't say scenarios. I'm thinking case studies, and we'll get to that in a moment. But we should make these issues, these concerns that are brought forward, a learning experience, if at all possible. We don't want everything to be punitive. We don't want to treat it like it is a court case. And I just saw Susan said, is it legally defensible? If it is in your syllabus, Susan, and it should be in your handbook, what will happen? Okay, so if you have a score that, you know, you obviously would word it better, but if there is ever a question of validity of a score, that a verbal exam or some sort of verbal test will be given, then yes, it's defensible. But what I was going to say is we need to try to make these learning opportunities. So I know many schools who have academic integrity policies, but if they have a situation like the one that I just described, they will bring the student in, do what needs to be done via their policy. As I said, most of the time, the student just breaks down and says, yeah, I cheated. Why? Why did you do that? Most often it's, I didn't have time. Something was going on in my life. I took the easy, the easy way out or the quick way out. Didn't come to the instructor to ask for any type of delay, or, I just I did what I needed to do to get the score. And that is a perfect opportunity for you to be able to explain to the student why academic integrity is so important, why they should have come to you and asked for some grace, because many of us are people full of grace and we give grace, and teach that student how to handle it in the future. And hopefully, you know, if the student admits it and you feel that it's a good learning experience, maybe the student doesn't fail the exam, but they get the opportunity to take another exam, or maybe they do get a 0 for failing, but hopefully, they're able to continue on. We do need to try, if at all possible, to make this a learning experience. And I will say that there are some instances, and this should be in your policy, where maybe it is so blatant that you don't want it to be a learning experience. And I'll give you an example: taking tests. If you do online testing and a person, if you do online testing and a person pays someone to take their test, I have seen where that is written in the handbook that that is an automatic, dismissal, and I get that, right? I mean that's blatant. If you're going to have someone else do it for you, but again, it's all about your policies. And so, Susan, I'll say again, it's all about what you have in your policies. Um, I think I noticed that Keith had popped up our contract for professional identity formation, and I will go ahead and mention that KeithRN does have a contract to develop my professional identity. And this contract, it's part of our membership, but it covers everything. I mean, I say this is our A to Z. It covers a student's responsibility as an adult learner. And you'll see number 2 there, acting with integrity. It talks about coming prepared to class and clinical, acting civilly. It basically covers all that a student should do as far as professional comportment, ethics, and values, which includes academic integrity, leadership and advocacy, and of course, taking responsibility for developing their clinical judgment. So that is a great resource if you are a TLAN member that you do have available to you. I want to summarize some of the other key findings that Amanda's article goes into. One is that faculty should focus on intrinsic motivation rather than fear of punishment to promote academic integrity. And I kind of just mentioned that. Talk about the importance of academic integrity. Bottom line is this: the student who cheats in your class today may be the student who harms or kills a patient in practice tomorrow. That's the bottom line. That's why we can't accept cheating. And we explaining that to a student and getting them to understand that this is not a victimless crime, because students often feel that way. I'm not hurting anybody. They're hurting themselves. They're hurting possibly their future patient. So that is very important to tap into the intrinsic motivation. Why are they here to be a nurse? Faculty facilitated discussions. I will say this, for those of you that have policies, please do more than just say, hey, it's in your syllabus, it's in your handbook. Bring it up, talk about how important it is. That is a core value in nursing. Integrity is a core value for a nurse. And do that at least every semester. I know some people that do it before every exam, and they give students an opportunity to ask questions. Do you understand what this policy means? Do you understand the importance of integrity? If it's important, then we should take the time to discuss it. We should take the time to ensure that the students understand it and that they are able to ask questions. We also need to engage students in conversations about the policies. That's what I just said. And here's the other thing that came out of Amanda's research, that faculty should use real life scenarios to facilitate discussions on academic integrity. This goes right back to case studies. We love case studies at KeithRN. For those of you that know us, you know that we do. Dealing with ethical dilemmas, even cheating, incivility, whatever it may be, case studies are the way to go about doing that. So bring up a scenario. I don't think I really saw anything that you guys put in about maybe some different scenarios or issues that you're dealing with. I didn't see that in the chat, but I bet you've dealt with this. I'm sure you guys have dealt with this at some point or another. If you haven't, you will. Use those real life scenarios as a scenario for you to share with your students. And let me just give you an example of one. This is something that happens all the time. A student sees another student cheating. Should they report it or should they not? A student asks, let me use student A and student B. Student A has been working hard all semester to really develop their clinical judgment and learning how to ask the right questions and do the right things. And this student A is starting to perform well in clinical. Well, student B has been cheating the entire semester and is having a hard time in clinical. So she's constantly asking student A for information. And it's interfering with student A's clinical experience. Student A knows that student B is cheating because she told her that she's cheating. So again, this is another scenario. So should student A say something? Bring up these types of scenarios because I bet some students have dealt with it, and talk through those in class. Okay, here's your scenario. Now tell me what you would do. What should you do? Reporting is a big thing. Reporting is should be part of your academic integrity policy. If a student sees some other student cheating, again, it's about what? It's about protecting the patient. So students should report it. How do they go about reporting it? Can they do it anonymously? How do they do it? We need to talk about that. And that is a great scenario to share with students. I
was just going to jump in, Maria, real quick, if you don't mind. I just wanted to share some of the things that I saw from the article as well that I just want to maybe put an exclamation point that you already shared. One of those was basically the importance of promoting a positive culture of integrity in nursing education. And really what Amanda was saying is that emphasize learning and growth over fear and punishment, and really create a culture where you're a student learner and you're not going to get all A's anymore, but it doesn't matter because you know what? No employer is going to care about your GPA. They just want to know if you pass the NCLEX. So you can be a C student, but be a learner and understand the content, because that's really where we're not developing the clinical judgment competencies, because they don't understand the content. And if we can just, again, create a culture of learning, partnership, that you are a work in progress, and that perfection or this standard, we've got to just kind of bring it down and create that learning culture, Maria. I thought that was a powerful takeaway, and how we can kind of, in essence, again, change that culture and kind of put a different emphasis. And are we doing that in our nursing programs?
I wanted to ask another question of the audience. What methods are you using to promote academic integrity in your schools? Keith, you can stay on the screen if you want and stay in the conversation.
All right, I'll just kind of hang up.
So my question to you guys is, what methods are you using to promote academic integrity? Are you using scenarios? Are you having conversations with students about some of these issues? While we're talking about that, let's go ahead and bring up some other things. Please feel free, if you guys have any specific scenarios that you're dealing with, please drop those in the chat. Please also let me know what you're using in your programs to promote AI. And let's talk about this, because this is a couple of things that came out of Amanda's research also, is the lack of support from administration. Mm-hmm. And that's a problem, right? If you turn a student in for cheating and then nothing happens, they get away with it because you don't have the support of administration. Again, we're building that environment that is just inviting cheating. I wonder if any of you guys have dealt with that. And one of the reasons that, there are many reasons. There's fear of legal action. There's fear of student complaints or getting poor evaluations. There's also, if it's administration, they may not want attrition. There are a lot of reasons why that may happen. So I'm just curious if you guys have dealt with any of those issues, because those are good scenarios that we need to talk about as educators. How do we handle it if we don't have the support of administration? Okay, I see that some case studies are being used to discuss Um, Now, Laura, you said an AI tracker. I'm assuming you're tracking to see if students are using artificial intelligence. Okay, I'm assuming that's what that means. Sonia says, I wish that were easy to communicate, but our students want to be accepted in advanced practice programs, so they're constantly fighting for higher grades for increased GPA and possible acceptance. Yeah, hear that, Sonia. And that again goes back to our focus on performance over learning. Does GPA really mean all that much? Grades, did you guys, I mean, grades are pretty arbitrary, guys. An A in one school does not mean the same as an A in another school. Grading is very arbitrary. There's a lot of research out there that says grades really don't mean anything, but yet that's what we put all our emphasis on. And we're less focused on, did the student actually learn? I would love to have a Facebook Live on a book called Ungrading. And all the research out there that talks about how grading is just not a reliable thing, other things that we could do. That's a discussion for another question. But think about this. If you have a student that comes into fundamentals, and maybe they're already a nursing assistant and they know all there is to know about fundamentals, and they make an A, okay? So the student didn't learn a thing in your class, but they made an A because they already knew it. And you have a student that walked in off the street and didn't know what a blood pressure cuff was. And that student goes from from knowing nothing to learning how to take care of their patients' ADLs and do vital signs and understand what normal and abnormal vital signs and lab values and so forth are. Yet that student makes a B in your class. That B student learned a lot more than that A student. So that, again, just an arbitrary, I mean, grades are arbitrary. It doesn't really talk about where that student began and where that student ended. So anyway, I kind of got off track there, but my point is we put so much emphasis on performance, and that is high stakes environment invite cheating. So can we put some more formative assessment into our nursing programs? I think we can. Does everything have to have a grade? I don't think everything has to have a grade. None of us learned how to ride a bicycle the first time. It took a few falls, and that's what we have to do in learning.
Yeah, Maria, what I would add to that is that, when that carryover effect of college dishonesty and professional workplace behaviors had some very practical recommendations for educators. And one of the takeaways that aligns exactly with what you're saying is that design assessments that discourage cheating. And what that looks like, Maria, is open-ended questions with case-based scenarios. And you know what? That's the format that I've been using with KeithRN from the very beginning. And just that open-ended questions that encourages a deeper reflection. And again, using that strategy to promote learning. Again, open-ended, not just prescriptive, choose A, B, C, or D, because no patient has a multiple choice. That's not even preparing them for the real world of nursing practice.
Right. So, well, and that's exactly the way we should be testing our students. When most of the information that you see out there that says if you need to validate a score, that you should do a verbal test, but that verbal test should really be asking open-ended questions so that you can see and hear the students thinking. Do they really understand what they're talking about? You don't give them a multiple choice question to validate a grade, yet we're giving multiple choice tests to give them a grade and validate them passing, progressing, and graduating. Yeah.
I mean, look at, Maria, how we do clinical education. It's all open-ended. It's all verbal Socratic questioning that we're asking our students, what's your patient, how's your patient doing? What are the priorities? What's going to be that next step? What is it that you're concerned about, etc. We're having that verbal dialogue. And that needs to I wish that there's ways. I know that we have to give an evaluation, but there are, it's just limited, and it's not going to go to that extent that we need it to.
Right. Right, absolutely. I want to. I saw this question. I think this is a great question, and I would invite those of you that have good admin support to drop some answers in. But Deborah says, "I know what a lack of admin support looks like. What's a good example of what admin support does look like?" And I will just answer briefly, Deborah, that it's all about following your policy. So again, I'll go back to that scenario where the student, you don't have the black and white proof, but I say you do. If the student did a 100-question test in 10 minutes, if that should be in your policy that you're going to validate it. Now, if you validate it, if you ask this student 5 or 6 open-ended questions and they're rattling off answers, then you validated it, right? That there's nothing you can do. But I promise you, I have yet to see that happen. But you follow your policy, and then your admin will back you up. If the policy says this student needs to be dismissed or this student gets a 0, then you give that student a 0, or that student gets dismissed and admin says, yes, I agree with that. You followed the policy and you move on. It's that simple. It's just following the policies. But we have to be sure that you have good policies in place. And that's another best practice, is to make sure that we're looking at those academic integrity policies on an annual basis and updating as needed. Because I'm going to say one last thing about AI, artificial intelligence. 2 or 3 years ago, we weren't really talking about AI in nursing school. And look at all we're talking about now. AI. Everything is AI. And I mean artificial intelligence, not academic integrity. So some of us may not even have policies in place for the extent that artificial intelligence is being used. So have you updated your policies, and do you have, as I will use Susan's language, legally defensible language to back up AI? And I will say this about AI. We should be dictating, as the educators, how students use AI. So with every assignment, you're telling them whether they can use it or can't. You're telling them how they can use it. That is up to us to set those rules. If we don't address that and don't set the rules, then we really don't have a leg to stand on. All right.
Do you want to look at that, Maria, or not? That was the
yes. I completely forgot about those. This is Amanda shared this with me, Amanda Tracy, the AI assessment scale. This is a tool that is being used that you can give students to tell them what level of AI they can use on their assignments. Thank you, Keith. Yes, I had never seen this before. I thought this was a really nice and easy way to maybe share some of those policies with students about the use of AI. And I'm happy to, if you guys want that.
Is that in her dissertation or in the article, Maria? Where did you get that?
I think it's in her dissertation. I believe it's in her dissertation.
All right, well, we have the link over
I don't think it's in the article, but I do believe it's in her dissertation.
Okay.
Yeah.
Just one quick comment I would just add, Maria, with the AI tracking is that one thing that I have come across with that is that those AI trackers are so sensitive that if I wrote the best dissertation, if I wrote a dissertation or wrote a paper and I use Grammarly to polish the grammar, spelling, and that is going to show up on an AI tracker, even though it was an original article. The use of AI to do some of the grammar pieces. So again, defining what's acceptable and what you can use, because there's always going to be a trail of some kind, even if there wasn't a true, plagiarism done. The Grammarly does get caught in that and is defined as AI, though it really is not in the classic sense.
I was looking at comments in the
Anything you want to highlight, I'll pull it up for you, Maria.
No, I know we're down to 4 minutes, and I know you've got some things you want to wrap up with. I will just say this. I'm sure we'll have sometime in the future another discussion about academic integrity, maybe get into a little bit more of the AI piece. But just to wrap up, I will say that Amanda's research and a lot of the other research out there just says that we need to support faculty. We need to support faculty if we expect academic integrity to be at the forefront for our nursing programs. And that includes faculty training, that includes clear reporting mechanisms, having some peer support networks in place for faculty and for students. And I just dropped, it's a couple of chats up now, but I just dropped a great resource in for you. The International Center for Academic Integrity, they have great free resources that you can use. They also have an annual conference. I used to go to that annual conference every year, and it's fascinating to see what people are doing with academic integrity. Donald McCabe, who was the father of academic integrity, I met him there. Tracy Braytag from Australia, who's done lots of great research, met her there. There are great minds there, and it shows how important this topic is. That you've got institutions coming together, trying to ensure that we're promoting academic integrity, and that's where I'm going to leave it. This should not be about detecting cheating. This should be about promoting academic integrity. And just remember that that takes all of us. That takes the students, the faculty, and the admin.
And how about closing with some values, Maria?
So
Because
these are
really
the
what it comes
values.
down to. This where do you get this?
If you go to the International Center for Academic Integrity, that is the values of academic integrity: fairness, honesty, trust, respect, responsibility, and courage. By the way, they added courage just in the last few years. It was not one of the original values, but courage was added because we need to have the courage to report it when we see it.
Right.
It's that important that we report. Yeah.
And that's moral courage. I think there's a word for that, Maria, that kind of puts the two together, that moral courage to report a nurse who comes, or a doctor who's impaired, a doctor in the surgery who's got alcohol on his breath. There's a lot of things that you got to take a stand, and it's not always easy. So,
I'm going to say one last thing, because Wendy posted a great chat here, and it's too long. I'm not going to put it on the screen, but Wendy, you are absolutely right. Wendy said the most effective system that she ever dealt with was an honor council with students and faculty, and you are absolutely correct. You want students to be involved in your honor council, and actually students will be harder on their colleagues, on their peers than we will. That's been my experience. So absolutely get your students involved. And that's how you get everyone involved. So thank you, Wendy, for sharing.
Yeah. And I would even add, Maria, she talked about an honor code. Do we have an honor code in our student handbooks that really just, again, don't just give a blah, 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 but really kind of like, this is the values, these are the standards that we really want our students to abide and to embody and to live out, and holding our students accountable for that. So anyways, one of the things that I would just like to throw out there in the closing minutes is that, my passion with KeithRN is really creating resources that educators need to really support them to teach more effectively. And on this topic of academic integrity, I would just like to know, what kind of resources are you needing that would support you, whether it be case studies of actual scenarios that, again, like I have some incivility scenarios within the membership of like student incivility, naming it, but also kind of where you have a context to present it. I'd love to know if there's anything specific that those that are watching live could put in the chat before you leave as we wrap up this conversation, that you would like to have, or what you wish you had that you don't have. Because I'm all about solutions. My passion is just to create solutions. And that's kind of what I've done with a lot of the resources that I've developed and that Maria has collaborated with over her time with us. And, that's what I want to stay in that lane. I'm really, my passion is to create those tools for you, so your students can benefit and can be strengthened and encouraged and be the best that they can be. So if you have any thoughts on that, and it takes about a 30-second delay. While I'm waiting for some of those before we close it out, I just want to kind of highlight again, we've got about 20 plus clinical dilemma case studies, plus that honor contract in our Think Like a Nurse membership. It's for individual access at a monthly or annual price point, or programmatic. And so if you have if you're looking for a curricular solution, Maria does the demos and can actually guide that curricular approach, or for an individual. She's there to support any educator and is available to you. I also want you to know that Maria is going to be doing a webinar tomorrow. It's a free webinar. Basically just goes a little bit of a deeper dive for those of you that are not familiar with KeithRN and just wanting to know who is Keith, or what are these resources, the clinical course, the membership. Tell me more. If you just want to learn more, have a chance to ask questions, Maria is going to be doing a developing clinical judgment with KeithRN resources. That link is available to register for. We do it once a month, and it's coming up tomorrow. So those of you that are Friday morning at 11 a.m., we're going to be doing that. I also want you to know that Maria also is, just a couple things here, is also doing our demos for the clinical course. And there's the link to the landing page at the top. But if you're interested in just having a live demo and just do a group demonstration, those are the times, the Zoom link that follows. And you can simply just show up for that. No obligation, but want you to know that it's there to serve your needs and what that looks like. And so, in closing, is there any comments there, Maria, relating to just anything that you'd like to close? I'll let you have the final word.
I see that Samantha said that she would like to see a class on communication with students when these events are discovered and what the best practices are. So, and I think we can do that with case studies, scenarios, Samantha, using some of our real life, experiences that we've talked about tonight, and others, and opening up that dialogue. So I appreciate that.
All right. Well, Maria, if there's a closing takeaway, if there's kind of like, if you were just to kind of say, if there's one thing that you want educators to take away from this conversation or from this topic, if there's what would, do you have just kind of just a summary takeaway?
It's what I started with, that, you know, that saying, when you point a finger at someone, there's three pointing back at you. I think we have to consider that this is not a student issue. It is an environmental issue, and we all need to be involved: students, faculty, administration, and developing an environment that focuses on learning. If we're telling the students why they're doing something, if we're not giving them busy work, if we're giving them the opportunity to learn through formative assessment and not make everything high stakes, we're creating a learning environment. If we're doing the opposite of that, we're creating an environment that is focused on performance, and we're going to have cheating.
Awesome. Well, thank you, Maria, for just your passion for this topic and able to just bring it forward and be part of that needed reformation. And every one of us can be a part of that change. So let's do our part wherever we are. And thank you, Maria, for bringing that forward. And with that, we're going to close this session out tonight. Thank you all who came for this time.
Thank you, everyone.
Thank you for all you're doing to make a difference. And it is needed and appreciated. And thank you again for all you do. Take care.